everyone. I'm Megan Zweig, COO of Rock Health. Welcome to the webinar and AMA that we're hosting today. Super excited to have Firdaus Bhathena, Chief Digital Officer of CVS Health, joining us to answer your questions about the future of healthcare's new digital front door and sharing a bit more about how CVS is engaging consumers in their care through personalization, simplicity, and tech-driven solutions. Now, before we get into the AMA session, I'm going to be sharing some insights from our own consumer adoption report from 2019, going to give us a sense of what we've seen in terms of adoption trends over the past few years and anchor us in that, to then think about how transformative this year will really be for digital health. Also want to give you a sneak peek on some of our hot takes from our upcoming digital front door report. This research will hopefully provide us with a good framework, a jumping off point for our conversation with Firdaus today. We've already received more than 200 questions for this live AMA session via the registration form. So really already appreciate your engagement, your submissions. We have some great questions to kick us off with. We will not be able to go through all 200 of those questions, but you should feel free to drop any burning questions that you have below in the Q&A box at the bottom of the screen throughout the webinar. We do recommend that you share those questions publicly with the other attendees so that they can comment on them and they can also upvote their favorite questions. And we'll try our best to get through as many as possible. If you would like to receive the white paper version of our 2019 Consumer Adoption Report, definitely fill out the feedback survey at the end of the webinar. Zoom is going to direct you to that form. We really appreciate you filling that out, and of course appreciate any and all feedback that you have to share. Finally, if at any point you run into issues with audio, with your video, please do email us at partnerships@rockhealth.com and we'll work on resolving that issue for you. So we can go ahead and get started. This is a really transformative moment, and there's a lot of heavy things happening right now. I'm going to start on the other side of the spectrum and tell a bit of a light story about some time that I was spending with my mom a couple weeks ago when I was visiting her at home. We were watching a show on Hulu, and it was pretty amazing. One of the commercial spots was for Microsoft Teams, and they were talking about the use case of using Teams for telemedicine. So they had doctors talking to patients, they had doctors talking to other doctors. And I was like stunned because, of course, I've been talking about telemedicine for years, but it wasn't really something that the world was talking about. And I was like, you've made it as a sector when you're taking up a 30-second Hulu ad spot. And my mom gets curious about the service. So we're seeing dramatic changes and really dramatic behavior change when it comes to the utilization of digital health solutions. So if we flip to the next slide, we are excited to be surveying consumers this year. This is an endeavor that we've worked on for the past 5 years. This will be our 6th year of the survey. And we survey 4,000 US adults to understand consumer adoption trends and behaviors and attitudes and preferences when it comes to different digital health solutions. So certainly eager to see what the data tells us later this year. We've actually delayed our survey launch a little bit just because we want to be able to ultimately capture and ask people about the past few months of shelter in place, of COVID, of changing behaviors, and see what were those initial behaviors like, what has sustained, and what do they anticipate their behaviors are going to be moving forward. So certainly subscribe to the Rock Weekly, track us if you're interested in seeing that data later this year. But I wanted to give some context on what we had been seeing in the years prior, working up to this point. So you can see kind of through 2019, a relatively steady upward trend in terms of the adoption of things like live video telemedicine, wearables, using connected medical devices to monitor different health tracking, going online to look at provider reviews, look up health information. So you can see, last year, about a third of people had used live video telemedicine. So what I want to focus on for this webinar is, at least from the get-go, a little bit of what we see on the far hand right of the slide. So online provider reviews, online health information, because I think it shows a big sea change in terms of how people consume healthcare data and go about navigating the healthcare system. So I want to get into this Dr. Google phenomenon where we're regularly turning to the internet to learn more about our health and our care options. So what the data is showing here is that most people, so actually nearly half of respondents, are searching for providers online. So whether that's pharmacies, hospitals, physicians, and that number's been growing even for searching for nursing homes, for caregivers. What's more is that for about half of those people, so this is the numbers in the blue boxes towards the bottom of the slide, half of these respondents are turning that information into actionable information that is helping inform their decisions. So more than half of people are selecting providers based on the reviews that they find online. So online presence, reviews, definitely matters. And people aren't just looking for information about their providers. They're also looking for information about their symptoms. So this next chart is showing the percentage of US adults over time that are searching for health information, and it's more than half. So the green line is showing year over year the percentage of people that say they look for prescription drug information online, the percentage of people that look for diagnosis information online based on their symptoms, and finally look for treatment options online based on a diagnosis. So most people, when they want to learn more, they're going online, which probably isn't too surprising. What might be a little more surprising is that this information largely seems to be trusted. What people find online, they are bringing to their doctors, they're bringing to physician offices, online or in person. And what this is showing is the percentage of people across different age groups that take a particular action based on information that they found online. So that first grouping of bars is showing the percentage of people in different age groups who propose a diagnosis to their physician based on information they found online. The middle shows the percentage of people that ask to be prescribed or to stop a particular prescription based on information they found online. And finally, those that propose a treatment plan based on online information. So I think you can read this in part as a step towards patient empowerment of patients taking action in their care. I also very much see it as a desire for continuity. So as a patient, I want the information I'm finding online to inform the conversation I'm having with my provider. I think you start to see that what patients are looking for is this continuous journey that connects the dots. It's no longer I'm just getting all my information in a clinic from a doctor. Information is, much more democratized in a lot of ways. And there's a lot of data and a lot of options to search for information online. We see plans, providers, employers, pharma companies vying for eyeballs on that information on what we essentially call the digital front door experience, because they want to capture the value that's going to be downstream of that initial interaction. So let's talk about the digital front door. Our definition at Rock Health is relatively simple. It's a series of steps along a patient journey that happen between the patient deciding to explore care options and then ultimately accessing care. This doesn't necessarily have to be a digital front door. There are analog versions of all these steps, learning about healthcare options, learning about your own health, selecting a provider, scheduling an appointment, navigating to care access points. All these things could happen in an analog way. You could call up your provider, make an appointment, etc. But what we're seeing increasingly is digital tools supporting this journey in each of these steps. So for example, on the next slide, we've mapped out a couple of patient journeys through a digital experience. So in the first example, patient has abdominal pain. they consult WebMD, they run a Google search to find a provider. In this case, they're looking for an urgent clinic, and then they drive to the clinic using Google Maps, of course. Or in the second example, maybe they're using an online scheduling system to ultimately book an appointment and drive themselves to that appointment. I bring up these examples because I think they're good examples of what I think of as digital front door 1.0. You're replacing an analog experience with a digital one. Next, I wanted to look at what do we think of digital front door 2.0 and what might that look like? So these next generation digital front doors are going to offer care that is proactive, efficient, and integrated. I explicitly picked those adjectives for our title because they mapped the benefits of the patient journeys outlined below, where the digital front door experience become a greater value add to the patient, not just a digital version of something that they would have done in an analog way. So first, someone gets a health alert from a smartwatch, so they reach out to their physician. In this case, care is proactive. It doesn't require the patient to even know that something may be off. The monitoring lets them know when to seek care in a more preemptive way. Next, patient with a cough. They use a symptom checker, immediately are taken to a virtual visit. Look at that. You've actually just bypassed the step of booking an appointment, of waiting, of getting to the appointment, so it's efficient. Increasing access. And finally, maybe you have a child with a fever. You use a smart thermometer, and that information is ultimately integrated into the pediatrician's EHR so that you're capturing important information in between visits and you have that more integrated experience. So these are really just a handful of examples, but hopefully you see the power of the innovation that we're seeing within the digital front door to make care more proactive, more efficient, and integrated. Getting this right is going to make a world of difference for healthcare enterprise companies that are looking to manage patient health, direct them to services, and ultimately capture the long-term value of that relationship. So definitely look out for more from us here. We will be sharing our digital front door research later this summer. The full report will be available to Rock Health corporate partners and consulting clients. So if you're not a partner yet and you're interested in becoming one, definitely reach out to us and we can certainly chat about that. So that is the end of my slide run. So definitely want to turn our attention to CVS Health and Firdaus, who are doing a ton of work in this space of digital innovation across the consumer journey. So first, Firdaus, thank you so much for joining us. We're thrilled to have you.
Oh, you're very welcome. Happy to be here. Great audience. Thank you. Awesome.
So let's talk about CVS Health, what you guys are doing to improve access. I think we want to start with the changes brought about from the pandemic. It seems like an appropriate place to start right now. And wanted to ask, how are you thinking about leveraging both your community footprint and your digital experiences to reach and serve your customers, especially right now?
So that's a great place to start. Thank you. Thank you for having me. You know, I came to CVS by way of Aetna, so that's about 1.5 years ago since the acquisition of Aetna. And it's truly amazing, you know, how many touch points CVS has, you know, across both the sort of in-person or physical touch points as well as digital, right? It's that breadth that has enabled us to really have a dramatic impact on, you know, the response to the COVID pandemic. At last, we started out with 5 state-sponsored testing sites in 5 different locations, testing up to about 5,000 people a day. And today we have over 1,400 sites. I'm very proud of that, across, gosh, you know, every geography in the country. And we're continuing to ramp up. That's been a pretty Herculean effort all across the company. I mean, this has not been a digital-only effort, but screening people up front, you know, having them take a symptom checker up front, getting them into a scheduling flow, enabling them to find a location near them that is convenient to them. I still remember when I got a call from somebody who said they have an 86-year-old mom who was scheduled for eye surgery on a Monday. It was a Thursday, and they needed to get a COVID test done before she could go into surgery. So there's many, many reasons why people are needing to get COVID tests. And we were really the only game in town when it came to a point of care test near where she lived, where she could go in and get a test and the result, within 2 days of the surgery, which was the requirement. So we mobilized our entire health services team on the digital side to focus on delivering to people a set of COVID resources and also giving them access to these COVID testing sites. It's not stopping there in terms of returning to work or returning to school or opening up tourism or, I can't predict where the world is going to go. I'm the digital guy, all right? but I can tell you that, whatever twist and turn this pandemic takes, we're well prepared now, not without a lot of tremendous burning the midnight oil, that to be able to actually scale this in a dramatic way. Yeah. And the digital tools that we've put in place on the front end have played a very key role to giving people access. Now, keeping that in mind, we also have focused on communities that are typically underserved and where a walk-in experience might actually be better, right? And I think this goes to your comments earlier about the front door not necessarily always being a digital front door. And, I'd be the first to stand up and say that's true. We need to meet people where they are. We need to help them where they need help. And we can't expect everyone to sort of crowd through, one front door. It's going to be multiple touch points. And thankfully, we are well prepared to be able to handle that.
Yeah, I really appreciate kind of your emphasis on how this transformation can be kind of a Herculean effort. So definitely kudos to you and your team for standing so many of those things up so quickly. And I do, have a set of questions from folks. So I will kind of shout you out if I'm answering one of your questions. And I wanted to go to one that we got from a woman named Melody from Progeny. And she had asked about how since the pandemic began, a lot of people are delaying necessary healthcare. I mean, you just brought up the example of the woman who was, getting, it sounds like really critical surgery. So that's kind of like one end of the spectrum, but especially for folks that are, managing a chronic condition or maybe don't have something that's highly severe that necessitates, physically going somewhere. How is CVS encouraging people to get the care that they do need when the typical route to do so might not be as available right now?
Well, this is where our data science and our digital engagement kind of works very closely together, right? If you think about it, having a fantastic data science team like the one we have would only be a science project if we can't actually use that data to help people. Helping us identify the people who need the most help and then being able to engage with them either digitally and frankly, sometimes over the phone, all right? I mean, I'm not, again, this isn't it might be a digital first world that we are in and, increasingly becoming. But there is, a non-trivial part of the population that still needs to be reached through other channels. So it's really an omni-channel experience that we go after. And this is where we've seen a dramatic increase in our virtual health, offerings. So with partners and with our Minute Clinic professionals who, like every other medical facility, saw a drop in in-person visits as people went through sort of the first phase of the COVID pandemic. But these people were invaluable when it comes to actually turning on, e-clinic capabilities with people on the people who need either regular healthcare. When it comes to COVID, we have a very, powerful program in place that we direct people to. But when it comes to sort of taking care of everyday health needs, we're actually proactively reaching out through digital and other channels, through email, through notifications. We have a text messaging program that's extremely powerful. We still have people, our pharmacies, our stores are essential and so never really closed. And so, hats off to all of our colleagues who have been on the front lines in these pharmacies, making sure they're clean, making sure they're accessible. So even in person, when somebody shows up and they have a question, we are able to follow up with a telehealth visit, with a virtual visit there. So think about this as, one of the ways we talk about this internally is it's like 2 years of growth in what we thought was going to happen over the next 2 years. all compressed into like a 3 month time frame.
Yep.
So not necessarily, oh my goodness, we invented some great new technology to, do things that we were never doing before. I think that's coming, right? We are at the beginning of a major inflection point in healthcare, and that's why I'm so excited about this field of digital health. But what we've seen over the past 3 or 4 months is basically compressing into a very tight time frame what we thought was going to happen with things like telehealth and virtual care into a very compressed, time frame.
Yeah, I've been seeing it's a bit like a stress test for the scalability of the sector and its ability to work for providers, for patients that have never used it before, but now by necessity have to try it out. One thing I guess,
if I can make this personal, right? Before I came to Aetna about 3.5 years ago, my primary experience with healthcare, besides having 3 kids, was that I'm married to a pediatrician, a practicing pediatrician for 26 years. I hope she's not listening to this because I'm going to get myself in trouble. But I've seen her use every digital tool on the planet to communicate, virtually with her patients today. And so you're exactly right. It's been sort of a stampede to try to figure out what is the best way to engage with patients at a time when seeing them in person is not always, a viable option.
Yeah.
Clearly as a kids doctor, she has to be there when kids are born and things like that. So there's a lot of frontline work still going on. But when it comes to regular healthcare, as Melody asked, a lot of it has turned to virtual. A lot of it will probably stay virtual for a while. And then using the virtual engagement to actually triage who actually needs to be seen in person is probably going to be the MO going forward for quite a while.
Mm-hmm.
I think it makes sense.
Yeah. One thing I wanted to get to was a question from, I think it's Neal O'Neill from OneView Healthcare. They were asking about how, everyone's kind of, being forced right now to use some of these digital tools. And we see a lot more intentionality, especially on the part of large companies, to build this digital front door or front doors. And this can actually create some fragmentation when you have, should I look at my health insurance app? Should I look at something that CVS has set up? Should I, just go to Google and see what comes up, use ZocDoc? There are just so many different tools. And so I think the question is around, how are you thinking about driving a frictionless journey for the patient and something that is going to still feel unified?
That's a really good question. And, we try not to think about it as owning the digital front door. Frankly, I don't think there's going to be one front door. We've already talked about, being consumer centric means we need to go to where the consumer wants us to be, as opposed to having them conform to something we want to shoehorn them into. A consumer might walk into a pharmacy, have a conversation with a pharmacist, and that might lead them to a virtual interaction, a day later or the same afternoon, going through a particular experience flow that caters to that consumer's specific needs. I think digital front doors are only valuable insofar as what they lead you to. If the outcome I have going in through a particular touch point is not something that works for me, I'm never going to go there again, no matter how attractive, beautiful, engaging that front door might be, because just like visiting a store in real life, you don't really care so much about like how I got in here. It's about what ended up happening with me from a healthcare experience standpoint. Mm-hmm. So one thing I can say for sure is we're taking a very, very open approach. We want to be able to have people come to the front doors we provide. We absolutely recognize that they might go in through the front doors our partner providers have, our partners in the technology space have, our partners in the healthcare and the primary care space might have. We we bring a unique set of capabilities to the table that we would like to make accessible to all consumers through whatever front door, they want to enter through. We don't measure ourselves, I guess, by how many people are coming through our front door versus somebody else's front door. We measure ourselves by who did we serve and what did we actually do for them? Mm-hmm. It's that meaningful health experience, whether it's for an acute condition, for a chronic care condition, whatever it is, that we care most about. And the value that's derived from there, of course, has to do, one, with a better health outcome for the consumer. That's paramount. And then trying to achieve that better or best healthcare outcome at a lower medical cost, because as we all know, healthcare costs have just, are out of control.
We got some interest about the text messaging program that you were talking about. Could you add a little bit more color about how you are leveraging text?
So it all started long before I got to CVS with the ability to let people know when their prescriptions were available to be picked up, right? I mean, it's a very simple, straightforward use case. We're delivering real value to a consumer by saying you have dropped off a prescription. Instead of having to hang around, wait around, or you're refilling something in the app, we'll let you know by text it's available. You don't even have to open up the app, and you can just, with a single tap, refill your prescription. With a single tap, you can get it delivered to your home, things like that. We have many tens of millions of people, have signed up for that. It's a privilege for us to be given that ability to text people, and it's a privilege we take very seriously. We are very, very careful not to abuse that. You do not get barraged with a bunch of, marketing messages. But it's a very powerful way to reach a very large number of people. I mean, one of the most exciting things about being at CVS is the tremendous reach we have across the American population. And not only are we within, something like 3 miles of 70+% of the American population from a physical perspective, but I think almost a third of the population and which means a lot more of the adult population has signed up to receive text messages from us. So we can reach people. We are very careful about how we use that, like I said, but it's a very effective way of communicating and engaging people in their own healthcare. Yeah. And it started with prescriptions, but it can be leveraged for things like chronic conditions, minute clinic access to the health hubs that we are rolling out in a very significant way, with a lot of wellness and well-being services, all of course under the control and consent of the consumer themselves.
Yeah, we've been thinking a bit more and have seen a lot of companies come through our own Rock Health deal flow that are focused in the behavioral health space. Saw a huge surge in funding for companies that are focusing on mental health right now, which makes sense. And I think a big component of providing culturally competent care is thinking about text messaging. We looked at a company that uses text messaging to connect with teenagers who may have been through a particular crisis or trauma, and the natural way to reach teenagers is oftentimes through text message. So it is thinking about strategically leveraging those touch points. We did get a question, and I apologize if I mispronounced this person's name, but from Janak Joshi. And just to summarize the question a bit, they're talking about how do you meet the needs of older, chronically ill patients when they're the high utilizers of healthcare. They tend to use some of those more analog versions, whether it's, phone calls, leveraging in-person visits, and may not engage as much potentially with, apps or text messaging, prescription renewals online, things like that. So I think there's some myth to that to some degree, in that we've heard from some of our founders that so long as you have kind of targeted messaging and education around how to use those tools, that seniors can be really active users. But on the other hand, we do see that they tend to be slower adopters to digital health tools in general. So wondering if you could speak a bit to how you're focused on the chronically ill senior population.
So I'm actually in the camp that you just talked about, which is if you have a targeted enough message and you're clearly able to deliver value that makes sense to the chronically ill senior population, um, the adoption of technology is just as high as it is in other demographics. I have this funny story about, 2 or 3 years ago, my head of engineering was like, why are we doing all this for senior people? Like, they're not going to be, using these apps as much as possible. Then he went to Florida to visit his dad, his retired father, who was, living in Florida. He came back a changed man. He's like, they're texting like teenagers. Like, it's crazy. And so I think they have a higher threshold for, value, that they need to be able to see how this is something that helps them directly. I have a father-in-law who's 83 years old, who is a chronic, has a chronic condition. Not somebody who would use phones or text messaging without there being a real good reason to do it. And boy, he's all over it, right? For managing his chronic condition. And I think as long as they have some help from caregivers to get them going, and if the user experience is tuned to them, I think you can make a lot of headway. Now, there is no one size fits all. There might be a one size fits many, but there isn't a one size fits all. And so we do have this ability that not a lot of other, corporations have, to provide that holistic experience, both in the physical and digital world, right? If you're not comfortable engaging in a telehealth engagement with somebody, outside of the COVID-19 situation, there aren't a lot of companies that have, 10,000 locations around the country where you can actually meet with a healthcare practitioner, whether it's a pharmacist for sure, or in, over 1,000 locations, a minute clinic nurse practitioner. And so I think with that combination, we've got, a lot of it covered. I would say that connected devices are going to rapidly mature over the next 3 to 5 years. I think we're going to see an explosion in the use of connected devices, especially for the senior population, especially for chronic condition management, in ways that we haven't seen before, where simplicity and providing actionable insights is going to be the focus. Don't just give me data. Don't just give me a fancy user interface. Tell me what I should actually be doing to make my health better. And if you can boil it all down and give me this thing we all talk about called the next best action, which is what should I do next to continue on my path to better health, that becomes a very compelling value proposition, even for someone who may not be embracing technology the way, my 3 teenagers do.
Yeah. And that's
well, 2 teenagers. One's already, one's older.
And that thread that you just pulled through of, data turned into actionable insights, the next best step. I think you could think of the equivalent from the provider's perspective too. They also need to know what the next best step is from a clinical decision support perspective. Since you kind of brought up the role of pharmacists and NPs, wanted to bring up a question that we got from 2 people, Jennifer Thomas and D. Sams, which is how is the role of pharmacists changing, especially as we increase telehealth home diagnostic services?
So pharmacists, I learned this when I came to CVS, and it doesn't surprise me, but it wasn't crystal clear to me the way it is today. Pharmacists are among the most trusted health advisors in the country. There's a lot of people who rely on pharmacists to help them with the many medications, especially the ones who are in higher need, people who have multiple comorbidities with chronic conditions, things like that. Like everything, technology is making it possible for pharmacists to operate more and more at the top of their license, as the phrase goes, right? And so you don't become a pharmacist just to stand behind the counter and count out medication. You become a pharmacist because you want to have a positive impact on people's lives, just like you become a physician because you want to do that. Pharmacists, we believe, are incredibly valuable in terms of being on the front lines when it comes to, if you need to do supervised COVID tests, they're there. If they need to work together with a healthcare practitioner in a minute clinic, for example, in that kind of a setting, to create a comprehensive health plan for you. Administering immunizations, vaccinations, things like that are things pharmacists can do, quite easily. And then we have created this notion of, pharmacy panels for people in, at the high end of the need spectrum, where just like being on a doctor's panel, you are on a pharmacist panel where you build a one-to-one relationship with a human being who intimately knows your situation and is able to guide you along the way. This is a marriage of both technology and that personal contact and that personal, guidance and judgment. We can use technology as we do today to take a lot of data and derive some amount of insights from it. That's going to just become more and more and more important. But it will not replace, at the end of the day, that personal connection that you need to build, especially for the people in the highest need and with the most significant conditions. And so I think pharmacists will end up playing a very significant role in that. Especially as automation and AI makes it possible for people to start the healthcare experience in their homes. And we're big believers in that. I love giving people this example where, being married to a pediatrician, we have a lot of friends and family who will call in and say, hey, here's a picture of an insect bite on little Johnny's arm, or, Jane is pulling on her ear and could you take a look at it? And they come over, and I think to myself, wouldn't it be great if everybody in the world had somebody like this to go to when they had an issue, whether it's for themselves or for their children? And I think that's what technology will enable us to do in the long term. We'll have self-service with AI-driven healthcare. We'll have connected devices collecting information that can then be used for some of this early first stage triage. Then we will have virtual consults to be able to connect to someone remotely, followed up by an in-person visit if that's necessary, as opposed to right now where it's an in-person visit or bust in many cases, not all cases, but in many cases.
Yeah, I love that analogy. I think it is such a privilege to have or multiple friends that are physicians that you can text and reach out to when something's on your mind. But the idea of everyone being connected to that capability is really nice. We got a question from Rajesh Agarwal, which is really insightful around, so to deploy new tools, models, and workflows, there's a necessity to discard the no longer effective solutions. Healthcare is not good at this approach. How do you envision the new normal sitting side by side to the old abnormal in the post-pandemic phase?
Great question. One of the things we really strive to do is to take very much a user-centered design thinking approach to all of the new flows that we build. Look, ultimately what matters, I keep telling our team, is we don't get credit for the technology we build under the covers. We don't get credit for, certainly not for how many, meetings we have or how many releases we do. What we get credit for ultimately is the experience we put in the hands of the consumers we serve, right? And so when you're trying to change the old normal, you got to make sure that the people who are implementing the old normal were part of that user-centered design thinking process. Human beings are just resistant to change. This is very much a culture thing more than a technology thing, right? We're just creatures of habit. That's why that phrase exists. And so we're not willing to change unless we truly understand why that change is required. And in many cases, what's in it for me, right? And so having that, as opposed to just showing up one day and saying, this is the new process that we're going to follow, having people, it takes a little bit longer, but especially when you want to achieve the kinds of scale that a 300,000 plus person company like CVS is trying to achieve, we do need to bring people along for the discovery phase of the new normal. a tremendous example for this is the work we're doing in the area of CKD, for example, chronic kidney disease. I was very proud when we started this, I don't know, about a year and a half ago, where I'm going to these discovery sessions, these design thinking workshops, where we have nephrologists in the room. We have the nurses who are currently serving, kidney care patients, people suffering from, different stages of kidney disease. We have architects, UX people, designers in the room. We have product management in the room. And most importantly, we actually have people who suffer from the chronic condition we're trying to solve. And if you do that, the word that we used a lot in those sessions was the word empathy. Do you have empathy for the consumer you're trying to serve? Can you fit into their life as opposed to making them fit into yours? And it's not just empathy for the consumer, but it's empathy for the people who've been caring for that patient, whether it's their family member, whether it's the nurse who's sitting in the room with you, who is conducting the current normal. And it's been absolutely a fantastic experience, and something that, the techies on the team are delighted to participate in, because, it's a mission they can truly believe in. So I hope that helps. I think it's not easy. Change is hard, but getting people along for the ride right from the get-go and engaging with the different constituents in a particular use case or experience flow is really important.
Yeah, I really appreciate that sentiment. It's not just caring for the patient, but caring for the caregivers. Hugely important theme we've been talking a lot about at Rock Health. We got a question about one particular group of patients and how you are thinking about kind of building empathy and building solutions for them. So Peter Denegi asked, what is CVS doing regarding social isolation? And are you looking at all at VR for therapeutic solutions?
So we absolutely have a lab within our teams, both within ourselves and our data science team, looking at technologies like AR and VR to see how they could. But I just have to say though, again, this is not a purely technology-driven thing. This is where we are very fortunate to have a number of really great, true medical and health professionals on our team, along with a range of partners who don't carry the CVS badge, but work very closely with us. So I think the most exciting thing is to say, how could these technologies actually improve people's lives by working with the people who take care of these people today, as opposed to a bunch of techies sitting around saying, wouldn't it be cool if, right? Look, I'll be the first to do that, but it's going to take a long time to get to something effective. When it comes to dealing with social isolation and with behavioral health issues in general, I couldn't even begin to list all of the things the company is doing. It's pretty tremendous. There's a lot of, Karen Lynch was on, did a session recently. Karen Lynch is the president of the Aetna Business Unit. She's very, very strong on the whole mental health and behavioral health front. Very keen to she calls it flattening the second curve. I think that's a phrase that's been used in the industry as well, right? We do have, not just because of social isolation, but also because of anxiety issues and things like that. Now, that's one area where telehealth has really been able to lean in. The limitation has been, as always in this area, the availability of the number of behavioral and mental health professionals that this country needs. We are unfortunately seeing an epidemic of this stuff. It can't be solved by technology alone. It can be certainly helped by technology. We have some great partners who are developing solutions for things like mindfulness and virtual therapy that we don't have to invent it all. One of the things we bring to the table is the ability to reach a lot of patients very quickly. And so we are leveraging that to get these solutions into these people's hands. I've often said, we look at the key technology areas that we think will impact health and healthcare in the next 3 to 5 years. And, this is not a very profound statement. It's AI for healthcare, it's connected devices, it's virtual care. We don't see ourselves as inventing all of the breakthroughs in all of these areas. There's a tremendous amount of work happening across the world in these areas. What we see ourselves doing to lend our strength to this is stitching this together in experiences that are meaningful and impactful for people. And the whole area of mental health is one such area. There's been, we are providing targeted financial support. We're providing outpatient counseling for hospital-based employees in New York, New Jersey, Connecticut through programs called like Give an Hour. Aetna's Resources for Living has been made available to all Aetna members, not just Aetna employees as it was in the past. Mental Health Awareness Month, we do a lot within the company and outside about that. Frontline healthcare workers are suffering a lot as they bear the brunt of the COVID pandemic. Outpatient counseling for them, improving their mental health awareness, knowledge, and resiliency is super important. And we've seen a 200% increase since March 1 in the virtual mental health visits as compared to the same period last year.
Wow.
So thankfully, people are taking advantage. It's probably not enough yet. I'll be the first to admit, but we're making progress.
Yeah. Yeah, we certainly think about the supply-demand mismatch, especially when it comes to behavioral health providers and just the surge in demand that we've been seeing. And I think, oftentimes we think about telemedicine or kind of mental health therapy as something that's a one-to-one, where it looks like you're my therapist, I'm going to log in online. And I think we're seeing a lot more of that, but we're also seeing solutions that are figuring out how do we scale that expertise. So how do we do it through asynchronous messaging? How do we do it through having content where, in a digital therapeutic instance, the technology, the software becomes the treatment? And how do we, incorporate chatbots? So I think from what you're saying, it's really that combination of how you use the tech as the tools to help scale the expertise and care that that people are able to provide. I did want to focus a little bit more on you, your role, and just the, what it takes to be an organization as big as CVS and have the competency for building digital experiences. So we got a question from Steve Street from Agility. And the question is, what expertise do you see lacking in organizations that are essential to producing exceptional digital journeys for patients?
I'll tell you the biggest, the most important thing we're trying to do is a culture and a mindset shift. We are slowly but surely getting the entire enterprise to think about, and I love the fact that our CEO has made a very public commitment to having CVS Health be the most consumer-centric health company in the world, right? Everything we do derives from that, even though that's kind of a high-level statement. But if you think about it, a lot of legacy organizations have a very inside-out view. What are the business units we have? How do we maximize profit within each business unit? What's our go-to-market strategy? And very often we lose sight of sort of the big picture. And the worst thing that can happen is you lose sight of the fact that you're actually serving the same individual. It's a human being out there who needs care in our industry. When we say consumer-centric, we put ourselves in the shoes of the consumer, put ourselves, in their lives, develop that empathy and say, the change in mindset we need is to say, this is about doing what's right for that consumer, and the profits and the revenues and the business success that any corporation, desires will follow. Now, we can't do it all. We have to make tough choices along the way, but this is much less of a, do we have the right technology people or the right skill sets or whatever, and much more of a mindset and an approach change. Certainly, our mission enables us to attract and retain the best technology minds out there, right? Which is super critical. There's no doubt about that. But if we didn't create this notion of a high functioning software product organization within CVS Health, then we wouldn't be able to attract these people and we wouldn't be able to achieve the results that we aspire to achieve. So in some senses, think about this as we are a high functioning world-class technology product organization within CVS that happens to be doing healthcare. And that's, that's not meant to be facetious. It's meant to convey a way of thinking that I think is different from what the organization might have been thinking 5 or 10 years ago.
Yeah.
And it's incredibly inspiring, and it helps us motivate people to do things like the compressed time frame in which we were able to get all of that COVID testing up and running in a way that may not have been possible without that kind of mindset.
Yeah. We got a question about kind of a similar mindset that you've talked about, which is like cultivating not just empathy, but this intimate relationship between patient and provider. And the question is around how do you, kind of easier to understand that intimacy and an in-person connection and relationship? How do you see intimate digital relationships?
One of the mistakes that we sometimes make is thinking that being consumer-centric and building that intimate relationship with the consumer means we only engage with and build software for or build experiences for the consumer. That's not true. Everything we do looking through the consumer lens, but very often what we're doing is building connections. I love that word intimacy, by the way. Building connections between the consumer and the provider, or the consumer, the provider, and the pharmacist in ways that didn't exist before. Let me give you a really great example. We have this thing we call the Specialty Expedite Program. And when I was, I can't really take a lot of credit for it. It was done by people before I got to CVS just a year and a half ago. But the process by which or which a provider schedules a specialty drug, these are expensive drugs. These are people who have serious conditions. And then it sort of makes its way through the approval process and the authorization process and the lots of phone calls back and forth and faxes and paperwork and all of that. It was taking too long. It was causing frustration, causing excessive work on the provider side, having the consumer or the patient be upset that, I just got told I have a serious condition. You're telling me I got to wait 4 weeks to get my first dose of medication? That's nuts. What I won't get into all the details, but what it did is it connected with technology, connected the provider, the patient, and the specialty pharmacist in a way that enabled that specialty pharmacist to take on all of that burden on behalf of the patient, enabling them to focus on their condition and not the agony of the administrative work that they have to deal with, enabling the provider to focus on continuing to have that intimate relationship with the patient while providing the support in the background to get the drugs to the patient in a timely manner, cutting it down from, I think, 3 or 4 weeks to like 1 or 2 days. Yeah. And yes, there was a lot of technology under the covers that made it happen, but the impact it had was all about like interpersonal relationships. And the fact that you no longer had to engage in a contentious back and forth. Once you took a couple of steps and gave your consent, right in that first visit with the provider, everything was streamlined after the fact.
Yeah. And I like that approach because I think it assumes like the intimacy and empathy is going to be there. That's part of human connection and what humans want. But what you were doing is stripping out all the really difficult administrative hurdles that were getting in the way of that, I think, very natural human connection.
We are huge supporters of the provider-patient relationship. People sometimes ask me, well, you have all these minute clinics. Like, what do you tell your wife when you go home about primary care? I'm like, listen, I've been told by our Minute Clinic professionals that like 50+% of the people who come into Minute Clinics don't have a PCP. And what do we turn around and do? We recommend that they get a PCP. Our Minute Clinics are the #1 referrer to PCPs in this country. We are huge fans of the doctor-patient relationship. We want to be able to support that and enrich that. And in the words of the question that we got, increase the intimacy of that relationship. I love the way you put it, stripping out the friction in the process, right? Anything that prevents you from actually having that empathetic, intimate relationship should not be there. It should just happen in the background. When we were at Aetna, we used to say, we want the financing of healthcare to fade into the background, not be the primary concern up front, which it so often happens today. And that's a mission we're on that, you know, will take some time, but, you know, I hope we can work with the rest of the industry to get there.
Okay, for our AMA, I'm going to give you the last opportunity to ask a question. So is there anything that our audience and I haven't asked that you wanted to get to today?
You know, I think one of the questions that I get a lot is, how do you see yourselves within the healthcare industry at large? And rather than feeling like we compete with it, of course we compete with people, right? Like every company competes with others. But the way we look at it is, if we focus on an open platform approach that takes the whole industry forward, then we'll all get to a better place together. There will, of course, be winners and losers, like in every industry. But I think it would be a mistake to feel that any one company, even the size of CVS, can do it alone. So we welcome partnership. We welcome working with us to, whether you're a startup with a very focused, solution for a very particular condition, or whether you're a large technology provider who would like to see how the technology you have could be applied. I can't promise we'll talk to everybody who comes across us, but I think that open technology industry approach, and a lot of us came from that world into the world of healthcare, it's high time we embrace that. Interoperability, putting control in the hands of the consumer, those shouldn't just be, legal and regulatory requirements. Those should be the things we do because it's the right thing to do for the consumers we serve. And I think that's a message I'd like to put out there and encourage others to, give me feedback on and continue the conversation on.
Yeah, I think that that's a great note to end on, especially because at Rock Health, we really try to sit in the middle of the market that you're talking about, between innovation being built by startups and the enterprise healthcare companies that are going to leverage that to move their businesses forward and move patient outcomes forward. So thank you so much for engaging us with all of these questions. Thank you to you all for joining and asking such great questions. We'll see you all soon.